Hello and welcome to LTC Heroes, live by Experience Care. This week has been an amazing week because I've done a lot of live streams, but particularly it's been fun because I've talked to Mark Klyczek 2 days in a row. As I mentioned yesterday when we were talking with he and Heather Duncan about marketing, I was excited to reach out to him way back in December. And I said, I want to meet some people on your team. Let's highlight their work. And he said immediately, we need to get Eric Gommel in here. He works with me in strategy and business development as the vice president. And so that's why we are here today to talk about that. Eric, welcome to LTC Heroes.
Thanks. Great to be here.
I like to start off the question from a human level. And I think this is exciting when you get two leaders like yourselves together. How did you all meet, Eric? Can you give me your first impression of when you met Mark and the way that he is leadership and why you wanted to join forces with him at Virginia Health Services?
Sure. So my early career actually was in long-term care in the facility level. So I have a background in nursing home administration. I also have a background in investment banking, equity research, and then health system strategy. And I actually met Mark probably about 3 or 4 years ago in my role as Senior Director of Strategy for Rochester Regional, a large health system, $2 billion system in Rochester. He was the service line leader for they called the long-term care group, but I think that doesn't really give it the credit. It involved not only SNFs, but it was home health, it was senior housing, a lot of different components, a fairly large service line, which was impressive in itself. When I met Mark, what I thought was great about him is, number one, he's great at executing on initiatives and just being successful, but he also does it with a sense of humor and sort of a management style that really attracted me. And we ended up I left there and went to Maryland to work for another health system. And a couple of years later, somebody reached out to me. They were looking for a VP of strategy for a company in Virginia. I recognized it right off the bat. It was Mark, who was the CEO of that company. So I reached out to him directly and I asked him what's he looking for in a person, because it's kind of a unique position for a company like Virginia Health Services. They never had this position. And he was like, I'm looking for somebody like you. And before you know it, here I am.
That's fantastic. And that leads me into, and before I ask you, Eric, about your specific role that you've kind of created, I'm going to ask Mark, why did you create this role? How did you envision it? I'm sure Eric probably customized it to his fit and to his strengths, but what were you thinking about a year and a half ago when you reached out to him?
Well, we were thinking a lot of things were changing at Virginia Health Services. So the CEO before me was here 40 years and the CFO 35 years. And both myself and the chairman of the board knew we need to reposition Virginia Health Services. And a key role is someone that has Eric's background, which is the investment banking, being able to do a lot of data analysis, putting together strategic plans. So we really needed someone that had all these different characteristics, and Eric is a very unique person. He has all of those. And so what Eric's been able to do for us is accelerate our growth and accelerate our movement and our strategy, because myself, I can only do so much, but Eric is really able to take the ideas and things that we come up with together and run with them and make sure that they're executed.
Eric, what did Virginia Health Services look like when you first got into the role? How long did it take for you to understand the resources, both human and financial, and then what were your opportunities? Can you tell me what your first couple of months looked like as you started to map out your role?
Yeah, so that's an interesting question. And I would say that what was interesting about Virginia Health Services was the platform. I'll call it the platform, the fact that the company operates in the senior housing, home and community-based, and in the SNF verticals. My first probably 3 months here would, if you were thinking about it in a traditional strategic planning sense, it was really looking at our current state and also the external environment. So in planning, you tend to, you need to establish where you are currently and then, what's going on around you. And so that's what I did for the first 3 months really was Mark said, hey, go do an external assessment. So spent a fair amount of time with my head down, just looking at the market demographically, competitively, I'm into geographic information systems. So a lot of different neat, unique analysis.
I don't often get to speak to someone, first of all, with your resume with as much strategy as you have, but also someone with the specific role in that focus. Eric, where do you spend when you say keep your head down? Can you give me some insight into what website you go to, where you're reading case studies, what kind of financial information you're looking at? There's not 20 reports that you can pay $10,000 for and get your hands on. I feel like a lot of times you're doing a lot of interpretation. It's probably like doing a PhD your first 3 months.
It's yeah. So I think one of the unique skill sets of strategy professionals in general is the ability to gather disparate information from different sources, synthesize it, and then turn it into something that's easily digestible. So a lot of this is, I'll call it blocking and tackling. It's going to the U.S. Census Bureau. It's looking at websites for different companies. It's looking at publicly traded companies in their SEC documents. It's looking at CMS documents, MedPAC, industry associations, and then pulling all that information down and trying to create, it's almost like creating a story that talks about where VHS sort of lies in the overall marketplace, because healthcare is really a local market business, and you need to know where you stand and where you're positioned in that market so that you can determine kind of what your next steps are going to be as you execute on your growth strategy.
Mark, I'd like to ask you I want to be a fly on the wall in one of your all's conversations. So I'd like for you to think of something in the last 6 months that you've had. I probably shouldn't call it a crazy idea, but I feel like I know you well enough that you're not going to be offended. You have a crazy idea, and so you bring it to Eric, and you want him to put some wheels on it and build a foundation around it and see how he can run with it. And I don't know if it's going to be something with workforce development, or if it's the way that you all run meetings, or a direction that you need to take the company. Can you think of an idea and give me an example, and then tell me how that first conversation started?
Yeah, I think probably one of the biggest examples is our strategic planning process and coming up with a global strategic plan. Because like Eric said, we have a really nice platform. We're in long-term care and housing and home care and everything else. And so Eric helped me in developing that strategic plan. But then we realized it's a little too overwhelming because there's just a lot there, and there's 3 to 5 years worth of work in it. So we developed these sprints, and that's what Eric has really been able to help us with, and really break down the strategy so that we can execute on it instead of just looking at how big the strategy is and not actually making any movement on it because of the size. So I'm sure Eric can talk a little more about how the sprints work, but that's been a game changer for us.
I'm glad you mentioned sprints, because about 9 months ago, my CEO at where I work at Experience Care, he said, "Peter, go out and read some books about sprints. I think you're going to really enjoy them, and you'll love running your team that way." And Eric, this is the first time anybody on LTC Heroes has mentioned the word sprints. So I think that there's got to be a percentage of the audience who's never heard of it. Eric, can you explain what it is and why you all decided to embrace that approach?
Yeah, so like Mark said, we spent some time. Well, Mark had I joined a few months after he did. He had put together sort of a basic set of ideas, initiatives that he wanted to pursue. We kind of went through a strategic planning process, created what I would say is our 1 to 3 year picture or strategic plan. We're in a time right now of immense stress for leaders and executives in healthcare and any healthcare arena, and so they've just got to keep. They're just trying to do the nuts and bolts, keep the lights on, keep the place operating, staffing, census. So then you're introducing all of these initiatives and plans and strategic plans, and that can be overwhelming when they're just, and actually many of the strategic planning items or initiatives mesh very well with what they're doing on a day-to-day basis. So the idea of the sprint was to make sort of these digestible pieces, take the strategic plan, break it down. We started, I think, with, I don't know if it was like maybe an 8-week cycle, but we've moved it now to a quarterly cycle. And then what we've done is we've tried to narrow them down to maybe even less than 20, and sometimes even 10 very specific initiatives with very specific deliverables each quarter. And what you're doing, though, is when you start to put them all together, you're actually achieving that overall annual strategic planning goal. So it's just a way to keep people focused, keep it simple, because that's what it's all about, is taking, I think one of the things that I do is take complex processes, ideas, and make them simple and make them digestible. And it's just a way to bring the executive team along and making sure that we're all focused and aligned on what our, the goals are for the organization.
And that shift in mindset and shift in methodology for execution, did you just execute upon it? Did you have to explain it to the leadership team, or did you just tell me how you presented that? Because I'm guessing someone else in the room had never heard of a sprint, and they're like, "What is Eric doing? He's going to take us to the track?"
Well, I think what's interesting and maybe the opportunity here at Virginia Health Services is kind of a blank slate, because strategic planning wasn't necessarily something that they embarked on with the whole executive team. So we had a chance to actually do this almost in a greenfield sort of way. So we actually introduced, we had an introductory meeting where we talked about the strategic plan, and then the feedback we got is there's a lot there. So we listened, and then I would say Mark tacked and said, let's think about making this more digestible. Let's shorten the time horizon for achieving these different things. We'll simplify what the number and sort of what we want to do in each one of those. And then I just kind of took the plan and rejiggered it around, for lack of a more technical term. And then we introduced it on sort of our second go around with the executive team. And I think the response was a much more, they were much more responsive to that. It was based on feedback that we had received on sort of our introductory meeting, that they really wanted it to be simplified, and I think the time horizons shortened, so they were just more focused.
Yeah, thanks. And Peter, I had 3 learnings from it, I'd say, at least. First and foremost, just so everyone knows, we're doing this in Microsoft Excel. So this isn't some fancy thing that we had to buy or pay 20 grand a year for. This is in Excel, and it's holding us accountable. Number 2, it's the majority of our agenda every time we meet as a senior leadership team, is everybody has to report out on their initiatives. Now, not everybody has an initiative every quarter. Maybe that's not the priority at the time, but everybody has to report on that, and that's the majority of our meetings. It's just talking about executing. And 3, even when we moved from the overall strategic plan to the sprint, that first sprint was too much. And I looked at it and I said, well, why did we only accomplish 50% of what we said we were going to do? And I had to take that back and say, well, Mark, you put too many things on the initiative list. So now we've pared it down, and now we're executing on closer to 75% of what's on the list inside of the 90 days.
Mark, thank you for sharing the insight, because I remember from your podcast, episode 20, I went and listened to it again yesterday before we got on our live stream. And I remember you saying what you did with predictable quality outcomes, you also did it in Excel. I asked you, I think my question was, how much did that software cost you? That sounds like that's $100K and that you just had to write a check for. And you're like, nope, Excel, we're doing it fine. And I think a lot of times when someone has a big challenge in trying to figure out how to motivate their team, you think of 20 coaches, and you think of software, and then you think of all of these trainings you're going to have to do. Excel's not very expensive, so I'm glad you shared that.
Yeah, Eric? when I was a hospital president, we reduced C. diff infections and mortality rate from tracking it on a whiteboard in my office. So we weren't even using Excel. We had Epic as a medical record, so everyone just assumes, well, you must be leveraging that. But really, just shining a light on things and having some attention is really a positive motivator.
The way that you all run meetings, and the way that you said you focus around, what percentage are you on the way to your initiatives. Over on our team, we used, and Eric's probably definitely familiar with the book by Gina Wickman from EOS Traction. So we run our meetings on Traction, which is very similar to kind of like, where are you at? What goal's not being finished? How can the rest of the team help you to get to the goal, to get to that final sprint? Mm-hmm. Eric, there has to be something about now that you've been with VHS for over a year, there has to be something that makes your job easy. What's special about Virginia Health Services that you came into the brand or to Mark's leadership that makes doing strategy and business development a little bit easier?
Oh, that's easy. It's the executive team. I am I really like how we work as a team, and how the executives have embraced strategic planning and the different things that we've implemented to help them, because that's really what I'm here to do. I'm really here to help the executives, help Mark in executing and facilitating their plan to grow, and our plans in improving the care we provide the individuals that we're treating. And so it was their willingness to embrace these things and embrace these changes that has made my job easier. I mean, it really is the people. That's what makes it easier.
In terms of 2022, what would you say that you're most excited about?
Well, I think what I've been very impressed with this whole time is that our team's ability to manage in this very difficult time, and the way that they've done it, and the way they've been able to adapt and just manage through some incredible obstacles. And I think what excites me is the stuff that we're going to be doing. I'll call it with workforce development and extending some of the programs and things that Mark and the team have put in place over the past year, and thinking about the things that we want to do in 2022. I think the other thing is getting some of our innovation around iSNP and institutional, implementing an institutional special needs plan. It was on our roadmap, and we were able to accelerate the timeline on that. So that's an exciting, I think, initiative that we're pursuing in 2022.
And lastly, as we start to wrap up, Eric, you have a diverse background, a lot of experience in strategy. Are there any components or pieces of knowledge that you picked up from a different job or a different role that you brought in that would be, I'm interested in your job. So I'm interested in what you've learned from outside of healthcare and brought into your job at VHS.
Yeah, I think so strategy, a lot of people want to learn about strategy and think strategy is cool and all that. But I think for me, what's made me successful in strategy is two things. One is operational knowledge. So having an understanding of how operations work is vital, because you can't really do strategy in a vacuum. And then actually the financial skills in the finance that I honed in the 10 years that I was in equity research and investment banking, that really has helped me in this role, because there's quite a bit of financial analysis. And just when we talk about Excel is something that we leverage hard, and I am an Excel jockey that was honed from 10, again, a number of years sitting in a cube at an investment bank doing Excel spreadsheets kind of drives that skill set.
Well, gentlemen, I really appreciate you both joining me. Mark, thank you for sharing some of your leadership team on LTC Heroes. I know that not all CEOs are willing to do that because they're afraid the competition is going to poach them. But working for you has its rewards. So I'm sure the two of you working together make VHS special in the way that it is. Thank you, gentlemen.
Great. Thank you, Peter.
Thanks.
Talk to you all soon.